Hello, my name is Dr. Shanda Blackmon. Welcome to the Baylor College of Medicine Lung Institute podcast series. We're here to communicate with all of our care providers, our learners, and our community, as well as patients, about how to improve lung health, how to educate you and all of the people around you about ways to prevent lung disease, treat lung disease, and maintain lung health. Hello, and welcome to the Baylor College of Medicine on-air podcast series with the Baylor College of Medicine Lung Institute. My name is Dr. Shanda Blackmon, and I'm the Executive Director of the Lung Institute. And I'm so proud to have Dr. Thomas Milner here today for our podcast series. Dr. Milner was heavily recruited to come to Baylor College of Medicine, and he's the director of the Biophotonics Program. And I see it says Nano Biophotonics. So tell us a little bit about what you do and how you help us out.
Okay, well, thank you. I'm very glad to be here. It's an honor and pleasure. So, yeah, I work with light. I got interested in light in college, and then had the opportunity to start applying light to medicine. And it's just been a great field, a great opportunity for me to be in. There's so many potential ways to benefit our patients with using light. And the nano part is that there's sort of a revolution going on in photonics in general, and that's to use nano-sized structures to engineer light. And so that's the general area of nano biophotonics, is the use of nano-sized structures to engineer light for helping people.
Wonderful. And you are helping us to do our innovation projects. You're working with all the surgeons in the Department of Surgery, especially working alongside Dr. Livia Eberlin in our innovation section. Tell me a little bit about that alignment and what you aim to do with this partnership.
Okay. Yeah, so there's so many opportunities, and a lot of times, we have different people groups, engineers, scientists, and clinicians, and advancing our patients' health and solutions for disease really just involves bringing people together so that they know. So, for example, that engineers know the problems that clinicians are making, and that the solutions are founded on good science. So that's kind of what it's about. It's bringing people together who have a common goal of helping our patients and making the world a better place. But to do that, we have to define the problems, and what the solutions might look like in order to actually innovate new ideas to help people.
And one of the things that you and your group has done is we'll have these sessions, either working with Rice University, working with biomedical engineering groups, Texas A&M, and other groups where we sit down, get everyone in a conference room together, and it's sort of the equivalent of speed dating, but it's actually science dating, where you meet with a collaborator. A clinician might have a problem. For instance, I see patients with air leaks all the time, and I want to identify how do I detect the exact location of an air leak. And I might meet with you, and we could collaborate and talk about how to solve that problem. What are the mechanics behind the problem? What are potential solutions? How has that been working out? Those collaborative sessions where we're partnering together, has some science been born from that?
Yeah, so we're just getting started.
Yeah.
My experience oftentimes is people that make an analogy, like, for example, I'll give a good example. When Julio Palmaz invented the stent, I think he was originally from Argentina, and he thought of those wire meshes that go up when you build a wall. And oftentimes it's that analog thinking like, hey, I had a problem like this, at another place, another time, and this is sort of how we solved it. Can we take those ideas and apply them to this problem?
Right.
And, of course they don't apply directly, but the analogy, I think. And so,
Right.
yeah, we're excited for that, and we're just starting out, so lots of opportunities in the future.
Yeah, and I think when you think of just the Palmaz stent coming out, the leap between a concept and an idea to an actual prototype is where I think a lot of clinicians really get held up. And I don't think they have the capacity to make that leap without bioengineers and biomedical specialists. Can you talk a little bit about your role in helping to deliver clinicians with an idea onto that next step?
Yeah, I think, one of the main aspects is an engineer or scientist's main goal should be to help the patient, right, and not get caught up in all the other parts surrounding it. But if there's a common goal of helping the patient, then there's a motivation to pull on ideas from wherever you can sort of get them and apply them to a solution. So, yeah.
So patient-centered delivery of innovation is always the best motive for any type of new technology.
Yeah.
And problem-focused patient-centered delivery of new technology is absolutely the best. And picking the problems that you want to solve and finding those solutions is, I think, key. Talk to me a little bit about the problems that you're working on solving now.
Okay. Well, we work in cardiology, heart disease, which has traditionally been a big area here at Baylor.
Right.
Using light to both treat as well as diagnose an image during a treatment. Working in ophthalmology, dermatology, and generally the idea is to try to use light to treat and not just image, because a lot of times in today's world you can see the problem, but if you can't treat it, if you can't do something about it, it's like, so what?
Right.
And it's kind of a downer, because it's like, oh, you got this problem, but we really don't know how to treat it effectively.
Right. So when I think of light therapy, I always think of PDT, giving the patient an IV injection of an agent that makes you incredibly sensitive to any form of light. Are you working in that space at all, of sensitizing and then delivering the light therapy?
I have in the past. I'm not right now. I mean, we are working and using light. Is a wonderful thing in life. Because it comes out in such tiny little increments. So in a dose sort of way, you can dose the light to extreme precision. Light can do so many different things in tissues. Photosensitization is one thing. But just light by itself will cause cells to act in different ways. It can activate sensors. It can change proteins. It can all sorts of things. And so a lot of the problem is getting the light to where you want it to go in the right dose.
Right.
And that's sort of typifies a lot of these therapies, is getting the right amount of light at the right time in the right dose to the tissues that need the light or can be benefited with the light.
And that's your expertise.
Yes. Yeah. Yes.
And when you're looking at solving these problems, tell me a little bit about an example of when you've used your team to solve a specific problem. I'm fascinated by the process of how you take that on and say, we're going to solve this problem and approach it.
So one of my first inventions was cooling of tissues for laser therapy.
Right.
And I was working with the clinician, Stuart Nelson, at the Beckman Laser Institute. And, he was treating these patients with vascular lesions. And the problem he was encountering is oftentimes he couldn't treat his patients well because the light would burn the skin.
Right.
And so we knew the problem, and we'd actually studied the physics of the problem. And so we were really actually sitting around having a beer one time, and we're thinking, okay, how do we cool the skin?
Yeah.
Because we knew where we wanted to cool, but we also knew that we couldn't cool our target because that would be counterproductive.
Right.
And so it was actually Stewart who said, in baseball, when they get a stinger, they spray like a Freon on the skin. Could we do that?
Yeah.
And at that time, I was the guy in the lab actually building things, and I'm thinking, gosh, spraying Freon on skin is a lot easier than all these other more complicated ways of cooling. And so we went in the lab and tried it, and it worked. And then one of the CEOs for one of the laser companies came by and to look at the invention and tried it on himself, and he thought, hey, it takes the pain away. And we thought, well, that's not why we invented it, but okay. But it turned out to be a huge success. And so it was a situation where a clinician had a problem, we understood the physics, and then it was just evaluating different known techniques, actually, of how you cool materials.
Yeah.
And so in engineering-wise, it wasn't anything spectacular at all, but it was applying some known engineering to a problem in medicine that hadn't really been looked at. And there's many examples like that.
Yeah, and I think sometimes it's the simplest solution that's the
Yes.
best one, and it's been right there in front of us all along. It's a matter of putting part A with part B.
Yeah.
And that's why we're so excited that you're here to help us put part A with part B. I think that's very exciting.
Yeah. Yeah, and a lot of times I've said this before, it's almost the solutions, like you just said, they're just as you just described them, but it's just taking the person sort of walking by and opening the box and saying, hey, this should work, or this might work. Let's
Right.
try it.
Yeah, yeah. Well, good. Well, I know that I'm really looking forward to working with you and coming up with some novel solutions. If it's possible that you can help me solve all of the problems in thoracic surgery, I can't wait for that. Well, thank you for
Let's
joining us today on the Lung Institute podcast. And I can't wait to have you back. We want to have you come back and specifically talk about some of the novel technology that you're delivering to our patients and how you're making a change on these specific collaborative projects with different providers.
I look forward to that. Thank you.
Yeah. So thank you so much for joining us today on the Baylor College of Medicine Lung Institute On Air podcast. My name is Dr. Shanda Blackmon. Please reach out to us at 713-798-LUNG, Lung. Thank you and have a great day.